Anything that has gone right that you really want to mention other than the wonderful caring and efforts of the staff and nurses that you've seen? What have we gotten right? What did you see from the coronavirus crisis? People rising to the occasion and doing things right. Let's talk first on we could talk politically if you like, but I'd also like to talk about the people on the front lines. You seem very proud of them all. So let's talk about what's gone right for them.
So many wonderful things that were done by our staff, by administrators, the industry, skilled nursing facilities, hospital working together to guarantee quality patient care. I would say, given the fact that no one knew what COVID was, there was no testing for COVID 5-6 months ago, we were working in the dark. The governor and his staff, to some degree, we're all working in the dark. This is a new, invisible killer. And we addressed this working together. We had conference calls with, and I've never seen this kind of unity where the governor's office and the Department of Social Services and Department of Public Health worked in conjunction with the Connecticut Association of Healthcare Facilities that represents our industry. And clearly there's the not-for-profit industry as well. And we had conference calls at night, 8 o'clock at night, weekends. We unified to fight this war, which is exactly what you should do during a war. The media was not always helpful, which is to be expected. Imagine if your soldiers in Afghanistan had newspaper reporters saying, oh, that soldier didn't shoot the gun properly, or, the general gave a bad order, we shouldn't do this. And unfortunately, that's what a lot of the media did. So that hasn't changed. That seems to be a constant for the mainstream media, picking and choosing, and in many respects using pretzel logic to come up with some sort of conclusion that, everybody did everything wrong and that's why patients died. No, patients died because COVID has a desire to kill the elderly, the sick, the handicapped, obese, etc. We know what it does. And no one was at fault. I can really say that the kind of unity that's necessary to fight a war, for the first time in our 70 years in business and in this field, we've never seen it before. So that was really wonderful.
That's so wonderful and positive. And your point about the media is well taken. We could probably spend an entire show on that. Yes, generally, and I always feel good news, things that are going right, don't often enough get the publicity that they need to get.
Yes.
I feel to an extent that some of the horrifying details of the illness aren't getting publicity either. I don't think there are some people who are not aware of how devastating it would be to get this idea that, oh, it's just a mild flu or the sniffles is... But again, that's another topic, but we digress. But that, it's okay. This is a conversation and this is how things go. So that's something we've heard before, that locally and statewide in Connecticut, and we've heard from people in Massachusetts as well, that they are delighted with the way politics unified and that there was unity to fight this war. Let's shift our focus right back to the healthcare industry and what changes might happen in the year ahead as a result of everything we're learning. For instance, Martin, under the Ryders Health Management umbrella, you have nursing and rehabilitation centers. You also offer home health care and companion care services and outpatient rehabilitation. So in response to the pandemic, what changes do you see Ryder making in the near future? In the near future and in the long term as well?
Yeah, I've given this a lot of thought. We think about it every day. And there are many things we are doing currently to address the changes. One of them is looking at air purification systems to guarantee that the patients that are in our facilities are getting clean air, not just filtered air from HEPA filters, which are not adequate. We have a system we're working on in one of our facilities, that'll be our first, which using ultraviolet light, which kills flu-like viruses. COVID is so new, no one is EPA or certified or CDC certified right now for air purification. So But we're pursuing that. We've reviewed 3 different systems, and we're aggressively working on that. We are making other changes. Telemedicine is a big change that has occurred during the crisis. There were so many people that tried to get telemedicine recognized as a reimbursable expense, so physicians and from not only locally, but even across the country, specialists could have access, see a patient via an iPad or a special tool, examine the patient, vital signs the nurse could take that feed right into the system, and you'd have a pretty good idea diagnostically what can be done. And during this crisis, the federal government fast-tracked and responded well to that. So the CMS has provided, I think, an increase. I think 27% of visits, as many physician visits across the country have jumped through telemedicine, which is huge.
And it's now reimbursable? It is?
Yes, during
That's
the
a huge
crisis, it's
change.
reimbursable. Will it be a permanent change? I don't know.
Oh, okay.
But during the crisis, they jumped on it. The federal government responded very well on this issue, and Medicare and CMS addressed that. So that's a change that I think long-term will stay with us. I also believe that because of what I talked about earlier, the lack of funding, the priorities now, we see how vulnerable these patients are that we care for. And they deserve better. And to say that we're going to take money out of care for the elderly and the sick and the handicapped and put it into the general fund to be used for other things, I think now there's some serious rethinking of that. The state of Connecticut, again, had that right-sizing and rebalancing catchphrase. That was a guise to cut funding. And now that they've seen the damage inadequate funding can do, it's life and death, I think that's going to change. I think astute politicians, the governor and others will look at that and say, okay, we tried that. This is the result. We're not going to do that anymore. And I do look forward to a positive impact. I also think that an issue for all healthcare providers has been tort reform. And we all know that lawsuits hurt patient care. They take away resources from hospitals because instead of the hospital nurse, the administrator being there in the facility caring for patients, making sure the care is good, they end up in court sometimes for months because lawyers and the trial lawyers, unfortunately, in Connecticut are pushing for lawsuits. They had 4 or 5 months to sit home and figure out, maybe we could make money doing this. So now we see an initiative by the Trial Lawyers Association to push for lawsuits. The governor astutely followed what most states did and provided immunity to hospitals and skilled nursing facilities during this crisis. We need to focus on patients, not on lawyers' lawsuits. That paralyzes the system. And to use greed at this time, which really that's what this is about, to negatively impact our patients and our care and our nurses is detrimental to the whole system. So I think we may see some real tort reform going forward so we can focus on patients and take care of our patients and make sure they're getting the best. So I'm hopeful in those areas.
Wow, so those are huge. So tort reform, air filtration,
Yes.
and the third one was?
Telemedicine?
Telemedicine, continuing
There's
to
many
have the
others.
respect.
There's many others. But
Yeah. So those are some changes you're looking at to maybe, you're doing it in crisis mode, but to keep permanent as we
Yes.
move forward.
Yes.